So what makes a hospital Adventist? I know that you will have to think very hard about the religious question. And I can see in your 19 questions, there was one just for us. I don't want there to be any question about this. The history of Adventist health system comes from the root of the Seventh-day Adventist Church and a belief that people deserve to live well and be healthy. And so our sanitariums began appearing in the 19th century as health and wellness places, including in the early 20th century, in 1908, the Florida Sanitarium right over on the banks of Lake Estelle. It's a great story I don't have time to tell, but the point is that it started with wellness and restoration and health. And in the 20th century, we did great things. We discovered how to do surgery in a sterile technique, and we developed antibiotics, starting with penicillin. And that started our journey for an entire century of acute interventional health care. And we have enormous things to be thankful for with that today. We're transplanting hearts, we're doing all kinds of incredible things, unbelievable technology. But as you all know, we cannot sustain this model. And so now we're seeing the entire public debate over what do we do to reduce our consumption in healthcare. And as a health organization, we feel the philosophy and the root that we have in health and wellness is bringing that back, and it's time for us to figure out a business model that works along with the continuation of these great things we're doing with acute care medicine. That's why you see here wholeness and healing. Those are combined. And healing for us includes the healing of the whole person. Even in a case where doctors, we might lose a battle with cancer or some debilitating degenerative disease, we can still heal the person in the process of helping them resolve that disease, even if it ends in what we would call a failure when the person passes. So we see healing as something that's very holistic. And then, of course, we have a lot of health principles that we've developed in a branded product now, Creation Health, that we see throughout our hospitals and we would love to see come to life at Health Central. And then, of course, we have very clear beliefs that we've expressed in our response on your 19 questions on what it means to run a hospital on Sabbath, for example. And I thank you for being so clear in your question. We're here essentially to bring to the world a closer relationship with God and show them how His example can help them live better and how they can achieve strength from this important Creator God that we believe in. And then that all results in us taking better care of our community. And everything is back to the community. And that's a vitally important concept. So a few minutes, if you will bear with us on our story. When you see a picture of a hospital and the ambulance is the featured element in the photograph, it's probably not a building that you want to write home about. This is a picture of Memorial Hospital Flagler in 2000. Very fine little rural critical access hospital in Bunnell, Florida. It was part of the Memorial Health System, which approached Adventist Health System in 1999, and after knowing each other for many years, said perhaps it's time for us to join Adventist Health System so we can see our future actually unfold with some ability to invest and do some things. Memorial Hospital, Ormond, had a certificate of need to replace this hospital, and they didn't have the money to do it. And so that was one of the principal elements of that merger. So we made the commitment in that merger to build the new hospital for Flagler. So if you're driving actually north or south today on I-95, just as you get into Flagler County, north of Daytona and Ormond, you'll see this new hospital, 99-bed facility. And I'll just share a quick picture of the performance at that place. We've gone from 1999, 2,400 admissions in Flagler to now 6,300. So somewhere between doubling and tripling their admissions in that 10-year period. They had 20 days cash on hand. I know that you're a well-educated board, but I'll say just for emphasis, that's not very much money. They're now at over 300 days cash on hand at the facility and able to make great investments in the future of healthcare for the folks in South Flagler County. Their EBITDA went from 8.5% of revenue to 25, almost 26% of EBITDA, and that's a very, very solid number. And their debt-to-cap ratio, the debt to total capitalization, dropped from 50% to just in the low 40s, which is a very, very strong number. By way of fact, we also replaced the Ormond facility. That was not part of the original commitment in the merger with Memorial, but after a few years we realized that there was really a problem with the location of Memorial Hospital in the city of Ormond Beach. It was landlocked and there were lots of covenants and things that kept it from ever having a chance of really growing, and in that case we needed to compete with Halifax and needed to do something bold. So this is the new facility. Many of you have seen it, I'm sure, northbound on I-95 or southbound, just north of LPGA Boulevard. And it's just a phenomenal story. I don't have time to tell you everything about it. They're just knocking things out in patient satisfaction and the processes and the throughput times in the emergency room. They're just doing a great thing. So since 2000, we have put $550 million into Volusia and Flagler counties. $550 million, $500 million that comes from our commitment to having merged there with the Memorial Health System and continuing to invest in where we already were, which was the Fish Memorial Hospital in Orange City. So let's talk about Orlando. This is the Florida Hospital brand. These are the 8 campuses on this collage, including the Children's Hospital. And we'll just talk a little bit about the market strength and essentially the octane that we would see bringing Health Central into and becoming part of. And this is a format that we've borrowed from the advisory board. I'm sure you've been to advisory board events or seen some of their briefings. We use their format here to give you a quick picture of what Florida Hospital looks like in terms of market strength in the Tri-County area. So on the far left you see a graph. The NRC Consumer Choice Award, we have used National Research Corporation for many years as an independent third party to evaluate how we're doing in consumer preference. And they have a very clear model in which they survey using telephone, and I think it's telephone instrument, the thing we all love to see ringing at dinner time, to find out whether or not people, what do they know and what do they think about hospitals in this market. This is not a Florida hospital survey. This is NRC saying, any hospital in the market, what comes to mind and who's the best. So by a wide margin, enough that in their statistical model, they will differentiate and give only one institution the award of consumer preference or consumer choice. If there's a wide enough margin, Florida Hospital has taken that solely in the past few years. So 48% of the market in the most recent survey said Florida Hospital is the best hospital, unaided. Right next to it in the same survey, I believe, Des, the NRC survey, they also asked people, I don't know what order the survey goes, but they ask them, what hospitals do you know in your market? And then they make a tick mark of the first name that someone brings up. And so 57% of the time, wherever you are in Central Florida, the first hospital people are going to mention is Florida Hospital. Then I've got some numbers here, 119,000 inpatients served. We are the largest hospital in the U.S. based on admissions. The next biggest, if you will, on admissions is New York Presbyterian, and they see about 95,000 patients admissions per year. That gives us a market share on admissions. This is inpatient market share of 48%. You can see that's been growing the past 3 years. And I'll explain some of our investments in facilities that have helped us drive that growth. Emergency department patients, I think Health Central sees about 50,000 a year, if I'm not mistaken, just over 50. And so the Florida hospital market is about 390,000 admission or ED visits a year now at our 8 locations. And that gives us about a 48% market share, which comes very close to our inpatient share. And then I mentioned the the bond ratings. You can see the change just in the last 2 years. We finally managed to get Moody's to cheer up and move us to a AA. We had the other two, Standard & Poor's and Fitch at AA already. So now we're universally AA rating across all three of those agencies. So, but just to set up this quick tour of our facilities in Central Florida, I want to just explain how we made the last 7 years worth of investments in Florida hospital campuses. In 2002, it was pretty clear to us that the admissions growth in Central Florida was being propelled by three powerful factors: population growth, aging, and comorbidities, things that seem to be making us need hospitals more per person or per capita more than in the past.